Hello, this video is going to show you why you need to learn CPR, and not just learn CPR for the sake of having a certification, but learn it so that you have a competency, because it literally can be the difference between life or death for somebody that needs it. Not only is it necessary, but it's extremely time sensitive. So if you have to face cardiac arrest, it is imperative that you act, and you act as soon as possible. And that's why it's so important we get this message out, because we see people that live from this because people are willing to jump in and act right away. If people don't act, it's so time sensitive that usually it's too late by the time the paramedics get there. So what you're dealing with, the reason you learn CPR is to prevent, not to prevent, but so that you can treat somebody who has sudden cardiac arrest. It's an important distinction to know, is because most people that die from sudden cardiac arrest, it gets called a heart attack. And there's an important distinction to make between the two. If you can see from this diagram here, is that sudden cardiac arrest is different than a heart attack. It's an electrical problem, and it's caused, the most common rhythm is called ventricular fibrillation. The ventricles are the big part of the heart. They're the main pump of the heart. And when there's an electrical problem, it starts quivering. And when it quivers, the entire system shuts down, which includes circulation to the brain and to the heart. And if nothing's done within a couple minutes, that person's chance of survival is extremely small. If not done within 5 to 10 minutes, that person is going to be dead. So it's an electrical problem, and the best fix is that you can do CPR and you have access to a defibrillator, because CPR keeps circulation going, and then a defibrillator is designed to convert the heart back into a normal rhythm so that it can work as it's designed. The difference is that a heart attack is caused by a blockage of a coronary artery. There's arteries inside of the heart, and when one of those gets blocked, it causes part of the heart muscle to die off. And when the heart muscle dies off, it gets to be very painful. It can cause shortness of breath, chest pain, pain that goes to the shoulder, to the jaw. It can cause the person to be nauseous. It is an emergency. They do need to see a doctor as soon as possible. It's something you should call 911 for, and it needs emergent treatment. But it's not as fatal as sudden cardiac arrest. If a heart attack goes untreated, it can lead to fatality, and it can progress towards cardiac arrest. But you usually have a lot more time to work with this. You do need to get help, but you can have a lot of time to deal with this compared to cardiac arrest, ventricular fibrillation. So the big distinction is, just think of cardiac arrest as an electrical problem, and a heart attack is more of a plumbing issue. It's a blockage of an artery, a blood vessel to the heart. Both emergencies, but cardiac arrest, you really only have seconds to deal with it. Now, what's the big deal? Cardiac arrest, how many people does it really impact? According to this data, it kills approximately 360,000 American citizens every single day. The bad part about it is that it can happen to anyone, anywhere, anytime, even if they appear healthy. A lot of times this happens to student athletes. It can happen to athletes of all ages. It can happen to male and female. And it can strike oftentimes without any warning. Now, someone that has an unhealthy heart and has chronic heart conditions can be at higher risk for it, but that doesn't mean it doesn't affect other people. It can happen, and it happens. It's a leading cause of death in the United States. So to give an example for this is, if you were to think of 3 jumbo airplanes, and if you were to fill those up with people, and you were to crash those into an open field, and everybody on those airplanes were to die, that would be all over the news. It'd be all over the media. But cardiac arrest kills that many people every single day in the United States. It kills approximately 1,000 people every single day in the United States. You don't really hear that much about it. And it's often just called a heart attack, and it's not making the media as it should. It kills more people than any of our wars. It kills more people than any causes of cancer. And it's really, heart disease is a major, major problem for life and healthy, and if you plan to stay alive a long time and lead a good life. 80% of these happen at home, and this says 60% of them are witnessed. So if 60% of these are witnessed, then that means there's a chance that you could save them. After 4 minutes, brain damage starts to occur. And after 10 minutes, it's most likely too late to do anything. So do CPR and have access to a defibrillator. So again, this picture just helps to show the difference. Cardiac arrest is an electrical problem called an arrhythmia, and a heart attack is caused by a blocked artery. It's a circulation problem. So there's two main interactions that are going to make a difference. Those two actions are early and effective CPR and early defibrillation. If these are done within the first 5 minutes, there could be as high as 80% survival rate. If nothing is done, there's 0 to 1% survival rate, and historically almost nobody would survive from cardiac arrest. Fortunately, with education like this and access to more defibrillators, we're starting to see a lot more people live. So AEDs, this is basic review of AEDs. A lot of them look different. There's a lot of different brands that make them, but they're easy to follow. You don't have to have a certification to use it. There's Good Samaritan laws that protect you to use it. So don't be afraid of these machines. They will only shock a person that needs it. So they're designed to interpret the message. They're called automated external defibrillators. They interpret the message, they interpret the rhythm, and they only shock something that needs a shock. They won't shock somebody that does not need it. So there's no liability that you have to worry about for using these. You know where it's at is the first step. Grab it as soon as possible, turn it on, apply the pads. If you have to plug the pads in, sometimes you have to. You let it analyze, and if it tells you to push the shock button, you shock them. And right after that, you go right back to CPR. It's really important that you do CPR consistently if the person needs it, because you think every time you stop doing compressions, that person's heart is not beating and they have no circulation to their brain. So if you're ever doing CPR, it's extremely important to minimize the interruptions and keep doing compressions. So that's why I just highlighted that. Immediately resume CPR, because the AED is only going to give one shock if it gives a shock. And then it's going to have 2 minutes without a shock. And then it'll analyze again. It may or may not shock. And then you have 2 minutes of CPR. So the way it's designed is 2 minutes of CPR, shock, 2 minutes CPR, shock, 2 minutes CPR is the way that all of these are programmed. Again, this just shows that every minute that nothing is done, their chance of survival goes down by 10%. So the best chance is if you can give a shock as early as possible. If you can start CPR as soon as they go down and then shock as soon as possible, you're going to see the highest chance of that person living. This just gives another example. Is the first part is the electrical phase. This is the rhythm that you typically see, which is called ventricular fibrillation. Electrical phase is here, where there's a lot of myocardial energy. The ATP is the cellular energy of the heart. And if you can shock in this first 4 minutes, there's a good chance you can turn it around. During this phase here, it's not as good. And during this phase, it's almost impossible to bring people back. So you really want to start CPR and AED here. If you start here, there's a good chance that with good CPR, you can get this rhythm back here and have a better chance of successfully resuscitating that person. So here's the chain of survival. Everybody that I've seen survived has had this fall into place. So it's really important that you recognize it as soon as possible. You call for advanced help. That you start CPR early, because this buys time. And then the defibrillation is what restarts the heart and gets the heart to a normal rhythm. Then you have to get into the hospital. That's why you call 911. So calling 911 gets the paramedics coming. You doing CPR buys time. And then the shock is what converts the heart. And then you get them to advanced care. So you see the two interventions you can do is CPR and AED, but it's also very important you call 911 as soon as possible, because they have the advanced care that can help. So chest compression CPR, here's a quick, simple way to remember it. Is the first step is make sure it's safe to help. Next is to shake and shout. You don't literally shake the person, but you want to tap them on the shoulders, see if they're okay. You want to see if they're breathing and if there's any movement. If there's no breathing and no movement, you move to call 911. You start your chest compressions and use an AED, call for an AED as soon if you have one available. And that's it. So thank you for watching. I hope that was beneficial. The best way to acquire these skills is to sign up for one of our classes. You can call, email, or text me. My name is Josh Wells, and we're happy to set you up with a class that's going to help you to save lives. Thank you.